Hey there, good evening, everyone, and welcome to Revolutionary Health. Revolutionary Health is a program of the Counter Narrative Project, and if you are regularly here, thank you so much for coming back and joining us. And if this is your first time here, welcome to the show. The mission of the Counter Narrative. On Facebook, we can be found at the Counter Narrative Project, and on Twitter, we can be found at Building Desire. So my name is Johnny Cornegay, and I have the pleasure of being Mobilization Director for the Counter Narrative Project, and I am joined with, next to me.
My name is David Malbranch, and I am a big fan of Daniel Driffin. Yay, Daniel Driffin. And if you don't know who Daniel Driffin is, Google him.
Please do.
He turned it out at a presentation we did this afternoon.
Amazing. Daniel is our brother. Shout out to Daniel Driffin. And we have a guest joining us. If you could please let the world know who you are and what you do. Welcome.
Okay, hi everyone. My name is Khalid El-Bey. I am your Leatherman of Color 2016.
Come on.
I'm also a full brother of ONYX MidAtlantic. And I'm a lover, poet, all that good stuff. And I'm happy to be here. Thank you for inviting me here.
No problem. Khalid, thank you so much for joining us. And so one of the things, this is continuing a conversation, right? So we've been having a series of conversations about PrEP, so pre-exposure prophylaxis. If you are curious about our previous shows, there is a playlist on the Counter Narrative page. After this show, you can certainly go back and view some of the other shows. But we wanted to have a conversation with you, Khalid, and we wanted to talk about. So we are expanding this conversation and really wanted to spend some time there. So I'm grateful for you for being able to join us tonight. But before we jump into the conversation, so David, I am going to start this show like I normally start this show. Can you tell us a bit about PrEP?
I'm going to be doctorly
Yes.
right now. So PrEP is short for pre-exposure prophylaxis. It's basically a medication. Now the only medication on the market is called Truvada. It's a little blue pill that has two medications in it. We've been using it as a combination part of therapy to treat HIV since 2004, but since 2012 we've been using it as prevention for HIV, people who are HIV negative can take. It's a pill that's meant to be taken one time, once a day, with or without food, and it's anywhere from 90 to 99% effective to reducing your risk of getting HIV. One thing I think I will note to people is that a safer version of Truvada is actually being looked at by the FDA right now and may be approved as early as the fall, maybe by October. So the only potential side effects we've seen very rarely with Truvada are kidney problems and bone effects, which we haven't really seen that much, but it's one of the things we look out for. But this version of Truvada, it's called Descovy. Some studies came out earlier this year saying it was just as effective in preventing HIV, and it also had the safety profile that was much better than Truvada. So I think on all those fronts, if this gets approved, it's going to be an option that people will use. We're already using this medication, Descovy, as treatment for HIV.
Okay.
But it has to be, they had to do separate studies for it to check it out for PrEP. So that's kind of the update there.
That's amazing. Because I know that, thank you. We actually did our previous show. We talked a bit about some of the research that's out there.
Right.
So thank you so much for that breaking news.
Pre-summer, yeah. So that's exciting. It's happening like right now. So I think people are pretty hopeful because it's a safer medication than Truvada and it's doing pretty well. That I think people realize that it's more than likely going to be approved, and then we'll be talking about that come the fall.
Okay. I think
Very cool.
one of the questions that, so for the folks that are joining us live, you can go ahead. There is a little chat button that is, if you're joining us from your phone, it's there. Or if you're joining us from your computer, you can certainly go ahead and send in some questions. If you have comments or questions, anything you have about PrEP, anything you have about ONYX as well, make sure that you go ahead and put that in. We have
all things leather.
All things leather.
Come on, Khalid.
In what, 30 minutes?
Come on.
So I want to jump into some dialogue. So Khalid, thank you so much for joining us. You have done a lot of work, and I've read several things for you actually where you talk about PrEP. Talk to us about your thoughts, experiences, etc. about PrEP.
Okay. My experience with PrEP. I I started taking PrEP April 2014. So I've been on PrEP for 5 years.
Okay.
Actually, I haven't had any side effects. Maybe the first day, it's really kind of hard to say because there are like some gastrointestinal type, side effects, potentially for people starting it. The reason I explored PrEP, it's kind of funny. My roommate at the time was Dominion ONYX in Washington, D.C. And we had come back from what's called MidAtlantic Leather Weekend. And he mentioned it to me as far as, what were my thoughts about PrEP. And quite frankly, I didn't know what he was talking about. I was like, PrEP, what do you mean? And so he was talking about this pill. And so I was like, okay, so something like, not quite like a birth control pill, but, as like prophylaxis. But I contacted my primary care physician at the VA center there. I'm a veteran also. And so I was able to access it through the Veterans Health Administration.
Wow. And one of the things that we talk about a lot is, access, and you accessed it early on.
Right.
What was that conversation like with your healthcare provider?
Right. Can you guys hear me?
Yeah, we can hear you.
Okay. That conversation, I emailed my doctor, her nurse contacted me, and honestly, she didn't know what it was. She didn't know what it was. I provided her more information within that email as to what I thought it was. She, in turn, reached out to the infectious disease clinic at the hospital. They reached out to me, and they were very welcoming. At that time, in 2014, I was one of maybe 5 veterans in the region that were accessing the Veterans Health Administration for PrEP. So, I feel sort of like I was like a trailblazer, in that regard, which makes me feel good. And I love telling my other LGBTQ veterans that they do have that benefit, whether or not they know it or not. But they do have it in their literature now as far as their LGBTQ care. It's a part of their profile, if you will.
That's good. What did you think about when your provider knew less about it than you did?
I was upset.
Right.
I was upset. I mean, why am I having to provide you with all of this information?
Right.
You're the doctor, right? But quickly, I realized that a lot of physicians, especially at that time, they just were not up on the information. I had pharmacists, even at the VA, asking me, was this for infection versus, prevention? In which just this year, I realized on the bottle, instead of it saying Truvada as PrEP, or even like Truvada as like prevention, it used to say for infection, but I wasn't taking it for infection, And so I can see how, say, maybe like some people that may have been prescribed Truvada, may have felt a certain way, going to their physicians or their ID clinics, or whatnot. Even at that time, I couldn't access it through my primary care team. I had to go to the ID clinic, in which I did have one doctor that was working with me. He asked me if I wanted to switch over to my primary care team at the time, but he was cute at the time, so I was like, well, I'll just stay with you.
Stay right here.
Exactly. Then he left, and then I started to go through my primary care team staff.
Yeah, it's interesting. That's not an uncommon story. And like in 2014, to be honest, even though it was approved, Khalid, like it took about 2 to 3 years before people started really picking up on it. And so it was mostly infectious disease doctors that knew about it because they knew about the medication for treatment. And then the primary care doctors, like the OBGYNs, the family practitioners, the internal medicine doctors, just didn't know what it was, or were kind of not wanting to be bothered with it and just said, oh, that's an HIV med, why don't we send it to why don't we send them to the ID clinics? Unfortunately, in 2019, a lot of that stuff has changed, and so you see a lot more primary care doctors. That's a lot of the work that I do, like trying to train internal medicine, family practice doctors, say, hey, this is our job, and we need to be knowledgeable about this stuff. And so when patients come in like you with your primary care doctor, it's not an infectious disease issue. It's actually a preventive and wellness care issue and a sexual health issue. And so trying to reframe it like that is helpful. But it is interesting. The other thing that you said that struck with me was that we have had to be more specific when we call it into the pharmacies, because when we would just say Truvada, if you had a pharmacist that wasn't that knowledgeable that it's used for PrEP, they would actually say stuff, well, you're supposed to be on another medication, and let me call the doctor's office, and then they'll turn it down because they'll say, we don't give Truvada for treatment. And so it would end up stigmatizing whoever was coming in for it, and then it would turn them off, and then they wouldn't come back. So, kudos to you for like sticking it out, and kind of despite all those barriers, you were like, shit, I want this, so I want this to be part of my options, so let me do it.
Perfect. Right. That, and like also trying to really press that envelope with the VA, because of course being a veteran, I mean, at the time that I served, it was don't ask, don't tell. So a lot of us in turn felt, oh, the VA is also like that, in which they're two different entities. So I really wanted to also press them with that. If you say that you're going to serve me, well, serve me fully.
You are a trailblazer.
Absolutely. And I want to bring in a comment. We have Michael Shaw said good evening and also had a comment. So the question is PrEP a generic term? And you talked a bit about this. So is Truvada the only version or brand, or are there others?
Yeah, it's the only brand that's licensed in the United States. If you go online or overseas, there are other pharmaceutical companies that do sell it at a much cheaper price. And that's a great question, because a lot of the stuff that was going on in Washington, D.C., Khalid, I know, like, this just happened in the spring, but, like, there were a lot of trials that were going on because Gilead, who makes Truvada, was being taken to task about it, like saying, like, hey, why is it so expensive in the United States to pay for, but yet in Australia it only costs like $18 a pill or something for a prescription. So they had to kind of deal with that. So Truvada is actually the brand name, so it's not generic. So, but the thing is that their patent on it runs out, I want to say, either next year or the year after. So it's actually going to be running out very soon, which is part of the reason for this newer version. One is for the safety of it, because it's a safer medication. Two is because a lot of people believe that Gilead just wants to continue to make their profits by having a newer version of this medication. So when the patent expires on Truvada and everyone else gets to sell it generically at a cheaper price, they'll still be able to make their profits from a newer version that they can say is a safer version of it. So I hope that makes sense to the person that asked the question, but that's a great question.
Perfect. Thank you so much for that question, Michael. And I want to...
Very good question.
So I want to bring this into the leather community now and have a bit of a conversation as well. You mentioned after coming from MAL that the conversation about PrEP came up. At that time, what was, or did you have a perception, or were there perceptions about brothers who were taking PrEP at the time when you started?
Okay. At that time, I didn't know of any brothers, within ONYX and or anyone else within the community taking PrEP. It just wasn't a conversation for me yet. Once I started it, I saw that, I wasn't having any side effects. I would have those conversations with other people, within enclaves, within the community, within the leather community. You have to realize a lot of our elders, they lived throughout the whole AIDS epidemic, in which it's still going on, so many of them immediately were on board with it. Why add HIV to, say, maybe like other illnesses, that we get, On the other hand, I mean, there are some are some continuously that kind of slut shame you
Real
for being on PrEP. But again, it's more of a preventative medicine, effort. It's always a really interesting conversation because you have people that are in, say, treatment, that say, oh, I take PrEP, with something else.
Yeah. Do you see that a lot in the leather community? And also, I was going to ask, because you were talking about it, and I know, like, the kind of slut shaming goes on in general LGBTQ communities, no matter what. And I didn't know, like, I know from a research perspective, just in general, folks don't use condoms 100% of the time and aren't really using condoms that much. Do you think you can speak on, say, your experience with the leather community? How often are other HIV prevention measures being utilized in the context of PrEP? So if someone's not taking PrEP, are people using condoms in the leather community? Or either more or less than other facets of the gay community?
Okay, so in my experiences, I feel that, people within the leather community probably use them and or not use condoms, at that same rate.
Right.
I mean, I can't say that, people are, raw dogging it over here and then, they're, being, protective over here or more, concerned about, prevention over there. My motto is this, I assume everyone else, is positive. I can only control or bring prevention, to the table myself, or at least for myself. So.
We actually had a really good question that came in from Charles Stevens, our executive director. Shout out to Charles Stevens.
Hey, Charles.
And Charles's question is, from your perspective, what would a PrEP campaign seeking to reach the Black leather community look like? I'm going to add to that question too. Have you seen any campaigns geared towards your community as well?
Okay. Yes, I want to say the equal, less, and or than campaigns. Do you recall that?
Oh, the U equals U campaign?
Yes.
Okay.
Yes, I want to say they actually teamed up with us during IML a few years back. That's International Mr. Leather. They teamed up with ONYX. I know that they had a couple of cutouts, like the big cutouts.
Well, that may be the greater than AIDS campaign.
Greater than AIDS.
Yeah.
Okay. All right.
Exactly.
That was about getting tested. Okay.
Yes, greater than AIDS is still, that is an ongoing campaign.
Oh, okay. Yeah. So I've seen that. Also, I know of at least one educational session. It's called Beyond the Red Ribbon, I believe. It's Rod McCoy. He's one of our founding brothers for ONYX MidAtlantic. He's been going around the country with this educational session that he presents. It not only talks about prevention in HIV, but other STIs, STDs as well. So,
from your vantage point, in order to, if you were to see a campaign that targeted the community, what ideas would you have for something like that?
I would hope that it would also bring people to treatment as well, not just prevention, because, you and I, we all know that, there are people out here that are not in care,
Right.
In which, that still, perpetuates that, epidemic. So I would hope that it would actually bring people to care as well. And also, maybe show the different faces of what HIV actually looks like within our community. I mean, there are, well, in which Mike is the doctor, so, he knows the stats, so.
Yeah. So I think one of the things that comes up for me as well to that point is I would I am searching for and excited about the opportunity to bridge gaps, in terms of being able to. So often, the community we operate in silos, and I think that PrEP and the conversations that we're having do offer us an opportunity to begin to have some more collective dialogue as it relates to HIV.
Yeah, and I think what's interesting is that Gilead, the maker of Truvada, I've been to meetings before, and their idea of diversity is just kind of making sure that there's enough diversity in sexual orientation, gender identity, race, ethnicity, that kind of stuff. I don't even think they're thinking about, well, hey, if they think of a leather community, they're probably going to go to the white leather community. But I think one of the things that they need to hear is that, hey, if you're targeting black gay men, like, you have to give different facets. So in order, like, make sure you're having people of different age groups. Make sure you focus on the leather community, the bear community. Focus on these different communities that exist within black gay men instead of just kind of, the kids that go out to the club every day. Yeah. So I think it's interesting. Do you think, are you hopeful about something like that happening? Because it may be good timing, especially with this new version of it coming out soon.
Yeah. It's an opportunity, I'm hopeful.
Would you do anything like that? Like, particularly, like, telling your story? Like, it's one thing to kind of be on the show with us, but would this be something that you would speak about on a larger level to the black leather community, to kind of encourage folks to use it as an option if they feel it's appropriate for them?
Yes, absolutely. Because, once upon a time, I was almost content with actually, possibly seroconverting at some point in my life. But now I'm like, okay, well, that might not be, my reality, and I think for so long, when, say, people find out that you're gay, you're within the leather community, you're one of those outliers, even from the mainstream gay community, that you will come down with HIV, so of course I would love to talk even on a large scale about my experiences with PrEP.
Absolutely. And I want to bring in actually a couple of, first of all, John Jordan says, hey. And hey, John. And I want to also let folks know, if you are watching, thank you so much for joining us. I'm going to look at y'all. If you're watching, thank you so much for joining us. Please go ahead and like this video, and make sure that's the thumbs up button, and make sure that you go ahead and subscribe to the page as well. David, I'm going to direct this question that came in from a viewer to you. Because I don't know if there's any research about this that you've seen, but have any of you noticed a significant decline in general condom usage among SGL people since the introduction of PrEP?
No, and I think that's a great question, first of all. And second of all, what we've noticed is that people haven't been using condoms before and still aren't really using condoms. And you can find some studies, people, depending on how they feel, can cherry pick a study that shows that condom use was increased when people started PrEP, and then there are people that could cherry pick and say that it was decreased. One of the things that I will tell you is that we have seen an increase in sexually transmitted infections following PrEP. However,
this is important.
Yeah, the caveat with that is that people will say, well, see, people are having sex with multiple partners and not using condoms. But the thing is part of PrEP as a program is that it involves you getting STI screening every 3 months. And then if you're a same gender loving man, if a good provider is going to swab your throat, your ass, and collect your urine to check all 3 spots for gonorrhea and chlamydia. And what I've been seeing is that there's an uptick with that, but I think part of it, if not a heavy majority of it, is because we're screening people a lot more. And so the goal is that when people are on PrEP, they're coming in and getting tested for other things. So I wouldn't necessarily say that because they're on PrEP, people are having more condomless sex and thereby getting sexually transmitted infections more. I think that may be the case. It's consistent or a little bit higher or a little bit lower, but I do think that people are coming in and getting screened and they're finding out that they have STIs, and then they get treated, which helps from a public health perspective to kind of reduce the load. So I think it's a good thing overall.
Yeah. Can Khalid, so in my in your experience, rather, for the regular testing, because I know that you have to go in every 3 months or so for follow-up for testing from, what's that experience been like for you?
Overall, it's been good. Sometimes those 3 to 4 months have kind of snuck up on me.
Okay.
Because basically you're going quarterly, 3 to maybe 4 months, whichever schedule you're on with your provider. Because I've been on Truvada's PrEP for 5 years, well, the physician I have now, I have a female physician in which, she's wonderful. She's a Nigerian. We have great conversations. I come in twice a year now. Okay. So I'm not coming in quarterly. And as you mentioned, as far as, the swabs and the blood draws or whatnot, more face time in front of a physician, you should be a little bit more healthier, right?
Yeah.
You would assume, because you're getting in front of them. So, that's more opportunity for them to see you and, do those diagnostic testings or whatnot. So that's something that, has been actually pretty good, for me, because it doesn't only, expose you to the preventative, healthcare. You could, maybe even explore mental health. You can explore the kidney functions, the renal functions, and all sorts of different things. So,
yeah, I think it's great that they do that, and I do think even though it's not officially recommended that people can follow up every 6 months, we actually do that with treatment a lot too. So I think it's logical. Like if you have a patient in front of you and that's the main thing that they're dealing with, and you say, okay, they're coming every 4 months and they're taking their meds and they're getting their STIs. Why don't we stretch it out to every 6 months? And you only have to come in twice a year. That's less of a burden on you. And then you always know in the back of your mind that maybe you can see her. If something comes up in between those 6 months, you could pop in and see her if you needed to, which is a good thing. I was going to ask you, did you feel comfortable? Because I think with PrEP, it's easy to talk about the medicine, but traditionally medical providers are really shitty when it comes to taking a sexual history.
Yes.
And they're shitty with talking, not to make the pun here, but I was going to say they're shitty about talking about things like douching and other things like that. But I haven't heard any medical providers or been to any training or conducted any training myself where we've actually said, does your provider ask about your involvement in the leather community? Do you discuss those things with her and some of the details of your sexual life? Or because you said you have a good relationship with her, so I was just curious, do you go in that deep with her?
All right, so she's only been my doctor for almost a year, so we haven't dwelled in my activity, within the leather community, anything to that nature. But I think with past doctors, I've kind of put my toe in the water with them just to kind of see how they responded. And I've noticed that, some of that hasn't made it to my medical record for whatever reason, Not that I'm looking for it, but I'm just okay, well, I mentioned that, is it going to become, part of my record, for say maybe the next doctor.
Yeah.
A lot of doctors, unfortunately, they're not really trained up on the different facets of, sexuality. They don't get the sexuality training. You can maybe vouch for that. Sexuality training and gender identity and things of that nature.
Khalid, you're speaking nothing but facts. Nothing but facts. That's all you're speaking.
So it's always very welcoming, relieving, when say I do have a provider that wants to, ask if say maybe I'm more insertive or, within sex or say maybe, do I have multiple partners or whatnot. They really start to dwell and you feel comfortable. And I think with my doctor, because she does ask those type of questions, I would feel more comfortable, with maybe, exposing, some of my, leather community activity, as it relates.
Would you be
all of it
surprised?
doesn't relate.
Would you be surprised if a doctor asked you flat out? If a doctor actually said to you, hey, do you ever get involved in leather or anything like that? Would that surprise you if a physician actually straight without you bringing it up yourself?
It would surprise me, but I think that it would warrant further discussion.
Right. That's good.
Absolutely. Maybe they have questions that they need to be answered.
Right.
Because like doctors are people too, right?
Yes, we are. We're freaks. Yeah, so it happens. Right.
Exactly. We all are subject matter experts in something, right?
Right.
Well, listen, Khalid, I'm going to bring in this comment. So Derek Francis just said truth. That's it. Thank you, Derek, for being on the show. So I want to do a couple of things. If you are still with us, make sure that you hit the thumbs up button and you hit the subscribe button. In terms of some final thoughts, we're going to start to wrap up the show. Any final thoughts from you, Khalid, that you want to leave with folks that are possibly considering PrEP, that may be part of the leather community or maybe even just interested in the topic?
Okay. If you don't get the answer, from your physician or your primary care team that you need, you need to find a new team. You need to find a new doctor. I feel that my providers are there, to service me, not to be judgmental, and or to even shoot down my ideas. They should be there to listen and to assist and or aid, So yeah, I think that would be the advice I would give. And also, if you're going to do it, be committed. Don't just get it and just have it sitting on a shelf. I've seen that many a times. It's like, okay, you went through the trouble of getting it, and now you're not using it.
Right.
So, and that was a cuckoo clock, just so y'all know.
Yeah.
That's good advice.
Y'all probably heard it at the top of the hour too.
It's all good.
Any final thoughts from you, David?
No, I think Khalid hit it right on the head. Is that people don't need to be judged, but then the points you made were, one, kind of calling the medical community to the carpet. You don't need to judge us. If you're not willing to prescribe me PrEP or entertain this conversation, I can find somebody else who can do that. But then also speaking to the accountability of us as consumers, as people who are sexually
we're paying
active.
those copays, right?
Absolutely. So if we're doing these copays, if we're actually going through the whole process of obtaining PrEP, why would we not take it if we're going to go through that whole thing to get it? When there's obviously a lot of people that would want to use it and would benefit from it. If you want to get it, you stay on it. And again, it's when you talk about PrEP, it's most effective when you take it as prescribed. And so it can be every day. In Europe and in some areas of the United States, we're actually doing also PrEP on demand, which we've talked about here before as well, where if you plan out your sexual activity, you take 2 pills, 2 to 12 hours before you have sex, then you take another one 24 hours after, and then 48 hours after. So it's a total of 4 pills. And I think what's happening is that culture is kind of pushing the medical community to understand that this is how a lot of people have sex and want the option to have PrEP rather than doing it every day. And it's still close to 90% effective when you do it that way. And so I think the argument for a lot of people is, why not present that option to someone who's sexually active and wants to just use it on demand rather than taking it every day, like birth control or like a vitamin, like you said earlier. So.
Right, exactly. I'm glad that you brought up the PrEP on demand. I haven't taken it that way. I haven't seen a reason for me to take it that way. But if you have your PrEP at home, well, you determine your usage, although, there are, indications on that pill bottle that tell you how to use it. So.
Right. I think it all depends on who's using it and kind of what their sexual activity and what their sexual life is and what they want their sexual health to be. So if it's better for you to take it every day and that's how you remember it, use it that way. But if you want to say, hey, I don't have sex that often, or I plan it out, or it's more convenient for me to take it on demand, I think there's good enough evidence to show that it'll be as effective that way too. So why not give people that option?
Perfect. We are actually going to wrap up tonight's show, but I do want to bring in a comment. So Jay was mentioning that he's that they are totally oblivious to the leather community and what it is. What we will do for you, Jay, is definitely go ahead and make sure that we list the ONYX website so you can take a look at ONYX, which
ONYX.
yes. So we'll make sure that we put that information.
ONYXmen.com.
Yes. So we'll make sure that we put that in the description so that you can get some more information there. And Derek made a comment here, and I'm going to make this the last comment. He said, a doctor told me in front of my dad, homosexuality is dangerous.
Yeah, that's just problematic.
Right.
That's just problematic.
Was this doctor's name Mario Lopez?
Yes, Khalid. So thank you. Oh, we have one final comment, and let me see. This is from Michael. Do people on PrEP skip condom usage, or do you, Dr. Malbranch, or any other doctors recommend still using condoms?
Yeah, I recommend what's going to be best for your sexual health. So I tell people, it's not my job to be the condom police, right? So my job is to tell people based on their behavior. So I usually ask people, and Khalid, you said this beautifully earlier, like I get into people's business, like say, what do you do? And if it's a same gender loving man, I say, are you a top? Are you a bottom? Do you use condoms? Do you not use condoms? Are you having oral sex as well? What do you do? And then we talk about that as far as how you're having pleasure, how you experience pleasure. And then I'll say, well, okay, these are the sexually transmitted infections that can be transmitted without condoms. And these are the ones that even if you wear condoms, you're still at risk of. And then I leave it up to you. And so if you're on PrEP, part of a PrEP program is suggesting, like, if you want to protect yourself against gonorrhea, chlamydia, some of these other things, condoms are still going to be a great way to do that. Absolutely. There are a lot of other people that are just like, you know what, I just don't want to use condoms, and I'll take the risk with these other STIs, but I want to make sure I'm protected against, and I've heard people say this, the big one, meaning HIV. And so what I say to them is like, look, your sexual life is your sexual life, so I want you to enjoy it and have pleasure with it. But these are the things that you need to look out for, especially if you live in a certain area of town where there's a high prevalence of sexually transmitted infections or HIV. That's what I'll tell them. But it's not my job to be the condom police. But I do tell them that's an option. So I have people who are HIV negative, whose partners are HIV positive. So I say, you know what? Your partner can be undetectable on your meds, and you could use PrEP, and you can use condoms. You could do all three if you want, or you can layer or mix and match different things at different times. It's really up to you. What you need to know, their options. They all work very well, and you have to do what's best for you. That's usually my message.
Perfect.
Yes.
Thank you so much for that.
Khalid just said yes.
That is I want to thank everybody.
I like having options too.
Right, options are good, especially with sex.
I want to thank everyone for joining us this evening. Khalid, thank you so much for joining us.
Thank you, Khalid.
And we will be...
Yes, you're welcome, David. Thank you.
No problem. Thank you so much for joining us for Revolutionary Health. We will see you on the next episode. Make sure that you follow us on social media, and make sure that you hit that subscribe button before you leave. Thank you so much for joining us this evening, folks. Have a good night.
Good night, y'all.
All right.